chemotherapy will leave you feeling ill and fatigued about 3 days after the chemo is administered, and that usually lasts a week, maybe two. Then you well, in my case, I had it every 3 weeks. So the third week, I was feeling better, and then they have you go back and they do it to you again. You may feel nauseous. You may not want to eat. The chemotherapy will typically leave you with, well, chemotherapy is killing any rapidly producing cells. So cancer cells, taste buds, mucous membranes. So you may not want to eat. You may have metal mouth, kind of a taste. In my case, it wasn't metal that I tasted. It was anything that I tasted seemed oily to me. I mean, even just plain old water seemed like it had an oil feeling to it. And I don't know if that was just the lack of the taste buds being there or what, but yeah, so we really had to kind of spice up the food for me to eat and to enjoy it. The radiation will leave you with fatigue. It's the gift that keeps on giving. That can go on for a long time, along with chemo brain. And it leaves you with sort of a sunburn in the area. As I mentioned in an earlier question, there's an area where they use a gel protective pad to keep the radiation from going too deep initially. So those first 10 days, they leave that on, they take that off, and continue treatment from day 11 to say day 25. And that leaves you with that sunburn that can be anything from a mild sunburn to something very painful. I've heard people say that theirs turned black and charred, and I don't know what, how many treatments they had, or how, how pale their skin was, but it is like a sunburn, although different. And then, for long-term treatment, they put you on something like tamoxifen or Arimidex if you're ERPR positive and HER2 negative, like I was. I was given tamoxifen, and they have cited in different articles something called tamoxifen fog. When I was first offered the tamoxifen, they had just changed the recommended dosing from a 5-year regimen to a 10-year regimen. So I'm on a 10-year regimen now of tamoxifen. So I've got about 7 years left to go on that. And it doesn't prevent your cancer from coming back, but it is an anti-estrogen hormone treatment that brings your possibility of recurrence down. Not completely, but it does reduce your possibility of recurrence.